explain it to the patient, because a lot of times they wake up from surgery with these on. I've had many patients who just have the bimalleolar fracture, skip the cast and just have these, and they wake up with this random boot on. So we have to explain it. So Sam, this is what's called a cam boot. Your doctors order you to wear this at all times, even when you're sleeping, and this is going to really help protect the surgical area so that you heal properly. So I'm going to open it up completely. There's some Velcro on the inside here as well. Okay, and there's no right or left. It's one size kind of fits none. And then there's these little pads in here, because patients, as they're wearing them, they may end up getting some friction underneath the straps. So what I'm going to do is I'm going to lift up your leg and support your leg, and we're going to put your foot in here, and we're going to aim to really get your heel back in there first so that we know it's nice and secure. So what I'm going to do is I'm going to place it down, but the patient has a very swollen, heavy, painful leg. So we need to be very careful with how, we're not going to just pick it up like this. We need to support the entire leg, okay? I'm going to kind of cradle it like a baby, and we're going to put it in. Now, this patient, I'm assuming, has incisions maybe on the sides. Now, if he has an Achilles incision, I'm probably not going to be cradling his leg like this, because that is going to hurt if I put pressure here. So I may be holding a little more proximally for that, and we want to try to have this open, and we're going to sit him down and lower his leg nice and gently into the cam boot, okay? And there you go. All right, how are you feeling? And keep checking in with your patient. So what we're first going to do is I'm going to put this over your ankle. That'll help protect that part and prevent any friction, and then we're going to just fold this over. So can you help me fold this over? Can you reach that? Now, patients oftentimes have hamstring issues, so we have to be conscious of that if they have a really hard time, okay? And how we know that this is fitting properly and not too tight or too loose is we take 2 fingers and make sure that we can fit 2 fingers in. If you can fit more than 2 fingers, we got to make it a little bit tighter, okay? So we're going to line up these straps here. And what I'm going to do is I'm going to come right in front of your ankle here and secure this strap. So I'll put it in here. I'm going to put 2 fingers in here, and I'm going to fold that over. That feel okay to you? Okay, I'm going to have you do these ones, and I'll work here. Bless you. So you can work on those. Okay. And then we want to make sure that we check with the 2 fingers. Everybody good? So again, this should be worn at all times. Now, if the patient already had it on and we came in for therapy, we know we want to take it off. That's a time to educate the patient too. So if we walk in, it's already on, we can talk to the patient about, has anybody talked to you about this, when you're supposed to wear it, blah, blah, blah. You can take it off, but at the end of treatment, you got to put it right back on. So you get to educate the patient twice, and that will help with knowing, do they remember how to put it on, the 2 fingers, and things like that, okay? So this is the cam boot. Most patients with cam boots, how are they getting out of bed? Long sit, yeah. And we're probably helping them, because this ankle is probably